Devon, getting straight into the practical sides of what to do with auditory processing disorder, how might we recognise it in the classroom?
One of the most common features would be where a teacher would notice that a student, there's a delay before they respond to a question or an instruction. So the teacher might say to the student, get out your maths books and find chapter 3, and your student with auditory processing disorder will just be sitting there for a few seconds thinking, what did she ask me to do? They might even look at their neighbour to see what they're required to do. So one of the most common things is a delay in responding to an instruction. Quite often they will mishear an instruction, so they might do the wrong thing because they haven't heard or they haven't processed the instruction correctly.
So straight away, a practical thing for a teacher might be to say, wait a little bit before perhaps repeating the instruction, just to see whether the answer or the action is actually about to come?
That's exactly right, because quite often these children, it's not a question of them not understanding what the teacher said, but they just are slower to process that information. So
and we just don't give them the chance.
That's right. Also, a child with auditory processing, one of the most common symptoms is that they're often very bothered by background noise. So if there's extraneous noise in the classroom, they'll have much more difficulty processing what the teacher's saying.
So acoustic treatment of classrooms would be a pretty good idea.
Very much so, and quite a simple thing to do these days. Another issue for children with auditory processing is that it can very much impact on their development of their literacy skills. So one of the major difficulties when you're learning to read and spell is to be able to hear sounds in words and distinguish sounds in words. And many children with auditory processing disorder, that's a major difficulty for them, so it impacts on their literacy skill development.
Related to that, I suppose, might be their social development, how they perceive different types of language, like compliments or sarcasm.
Exactly, because auditory processing disorder is very closely associated with the perception of language. So if you're not just processing what you're hearing, you will have difficulty with aspects of language. So one of the issues in auditory processing is that difficulty in understanding differences in tone of when we're spoken to. So they might confuse a sarcastic comment with a criticism. So if the teacher's saying, gee, that was smart, compared to that was smart, your child with auditory processing isn't going to perceive those fine differences, and they can feel very upset with a misinterpretation of a message.
So with perception of language, I guess accents would come into that as well, if a student had a teacher with a very heavy accent.
That can be a huge problem for a child with auditory processing, because one of the other difficulties that's been very well documented is that when the speech signal is in any way, we use the word degraded, it just means that the signal is not ideal. So that could be a teacher with a foreign accent, a teacher with a hoarse voice, teacher just has a cold or laryngitis, and so the speech isn't going to be as clear as normal, so that will impact on a child with auditory processing disorder. In fact, I had a student this year who had to be moved out of a class purely because the teacher had a foreign accent and he just could not cope in that classroom, whereas the other children didn't have a problem.
So what would you say to a teacher who might think that there could be some problems in the classroom, but they're not really sure what to do, or maybe they don't know whether they're just trying to guess too much as to what the problems might be? I mean, what's the next thing a teacher can do?
Well, I think in an ideal situation, the teacher then needs to speak with the parent and maybe, if possible, organise an assessment for the child. And in that assessment, we need to look at quite a few things. First of all, we want to make sure that the child can actually hear. And then we need to look at their language skills and possibly their cognitive skills, and then possibly have a specific assessment for auditory processing disorder if they can access that.
What about daydreamers?
Well, they're an interesting group of children.
I mean, I like to daydream. Does that mean I have auditory processing
disorder? Not
disorder?
necessarily. I think daydreaming can be result of three different conditions, and very often hard to distinguish between the three. Sometimes very, very bright children, very gifted children, are lateral thinkers, and so they'll have an idea and then their brain will just go off with a new idea, and that takes them off into this wonderful world of ideas. Then you have your child with ADHD, inattentive type, who just cannot sustain their focus for any length of time in the classroom. And that usually applies to any activity, whether it's auditory or visual or whatever they're doing. But our child with auditory processing disorder can appear to daydream, but what we find is they'll only switch off when they're having to deal with a lot of verbal instruction, verbal information. So it's like their brain just gets overloaded. So once the brain is overloaded with auditory information and cannot process one more iota, then they will appear to switch off and daydream. But in fact, it's just because their auditory system's reached its capacity for that point in time.
Daydreaming is, I guess you could say, a passive response. Does it go the other way as well? Like, do the students sometimes go a bit crazy?
With auditory processing, I think particularly the students that are very bothered by background noise and continually frustrated because they're missing a lot of what the teacher's saying. If there's a classroom discussion, they get very lost in that as well, and so that can be very distressing, and they're not achieving as well, so they can often get very upset. Some children will even cover their ears because they're so bothered by background noise, which can be, or they might even cry or hit out at other children because of the distress that they're suffering because of their disorder.
So they might not actually just be badly behaved, they've really got a problem and they need help.
Absolutely, and I think for teachers, any child with any behaviour problem, there's always a reason. No child misbehaves for no reason. So it's the challenge for teacher then to try and understand where that behaviour is coming from.
That's a bold statement, but I guess you've got some 40 years of experience in being able to form that opinion.
Absolutely.
You seem pretty confident of that.
Absolutely, without question. All behaviour comes from something, whether it's anxiety. Many children behave very badly because they're anxious about something. It could be a social situation at home, it could be about their learning, it could be about many things. And to me, all behaviour comes from some source. Children are not born naughty.
Now you've got a whole bunch of strategies that we can use in the classroom, but we'll come to those in another video. Devon, thank you.
My pleasure.